Well, good afternoon. Before I begin, I want to express my deepest sympathies to those impacted by the tragic events that took place in Nova Scotia yesterday. The people of Ontario and the entire country are grieving with our friends in Nova Scotia right now. My heart goes out to the families of the victims and the entire community. We salute Constable Heidi Stevenson, a veteran of 23 years and a mother of two who fell in the line of duty. My deepest condolences to the family of Constable Stevenson and to our RCMP family. We stand with Nova Scotia in this time of grief. Friends, these are indeed some of the darkest days we have faced as a nation. But in these difficult times, through these challenges, through this adversity, we have come together. We have banded together, and we're seeing what we're made of as a nation, as a province, and as a people. In the last couple months, we have faced the ultimate test. We were asked to put the interests of the many ahead of our individual interests. We were asked to make great sacrifices to protect our most vulnerable. And I am so proud. We should all be proud that as a province, we stepped up. We faced this enemy head on. We did not shy away from difficult decisions. We did the right thing. We listened to the experts, and thanks to our collective efforts, thanks to all of you, we have so far avoided the worst case scenario that we were all dreading. We've avoided the devastation that we witnessed in other countries. We're not out of the woods yet, far from it. We are still in the middle of a battle. We are still fighting hard to protect our long-term care homes and our most vulnerable. But today, we saw new modeling that shows there's some light at the end of the tunnel. The numbers clearly show that the steps we have taken as a province are working. And they're working because of you. They're working because we've all come together, because we're taking this fight very seriously, because we're throwing everything we have at it, and we can't let our guard down now. This virus remains a clear and present danger. My friends, we still have far to go, but thanks to our collective efforts, we're in a better position today. And I can assure you that we're planning for the future. I've asked our Jobs and Recovery Committee to develop a framework for a gradual, measured, and safe reopening of our province based on the data we're seeing today and based on our own unique situation. That framework must have strict criteria and key benchmarks that must be met before lifting or easing restrictions. This framework will be informed by the ongoing monitoring of the trends, by the advice of our Chief Medical Officer of Health, by our business community, and by our municipal partners, and above all, the health and safety of each and every person in this province must remain the number one priority. I know many are eager to go back to work or school, back to visiting our friends and loved ones, back to our normal lives. And we will get there, working together. But on a day like today, everything is put into perspective. While my mind is here in Ontario, my heart keeps drifting back to the people of Nova Scotia. In the midst of this pandemic, to face this unimaginable tragedy, to have the unthinkable act of evil rip into their community and into their province, nothing could be worse. But I know the resolve of the people of Nova Scotia. They are strong, they are proud, They will mourn. They will grieve. They will share tears and share sadness in the days to come. But they will band together. They will support one another and they will love one another. And every step of the way, they will have the support from Ontario. They will have every Canadian standing with them. Thank you, and God bless the people of Ontario, and God bless the people of Nova Scotia. I'll turn it over to Minister Elliott.
Thank you, Premier. As you've seen today, the updated modeling shows early but unmistakable signs that our collective efforts to stop the spread of COVID-19 are working. The province has avoided a significant surge in cases. The rate of growth day over day has stabilized, with the outbreak of this virus having likely peaked in the community. And we are trending toward a best case scenario rather than a worst case scenario. The optimist in us will see this as a sign for hope, and hope is important. But indeed, these numbers are not an accident. They are a result of months of planning and collective action to stop the spread of COVID-19 and flatten the curve. To the 14.5 million Ontarians who have helped us in our fight against this virus, thank you. But the realist in us must also understand that there are still hundreds of cases being reported each day in our province as we have significantly expanded the scope and scale of our testing. And our government remains concerned about the impact of this outbreak on our long-term care homes. Clearly, there is still work to be done. In order for these projections to become reality, each of us must continue to stay at home as much as possible and practice physical distancing. The reality is that we are in the midst of a journey. And while we now have our destination in sight, we haven't yet arrived. No amount of easing up or taking shortcuts is going to get us there faster. We need to remain vigilant. We've only made the progress seen here today because we have each adhered to the advice of the experts to stay at home and to practice physical distancing. We must continue to follow that advice. I know that doing so is a growing challenge. This is nothing any of us ever expected to have to deal with. And the truth is that in the coming days and weeks, we're going to be more tempted than ever as the weather gets nicer, as the strain of being isolated weighs on us, and as we see each other countries begin to loosen the rules and we wonder, why not us? Rest assured, we are actively planning for what comes next, for safely and thoughtfully easing our public health measures. But as we do, we need to continue to make the right choices that respond to our own situation here in Ontario. We need to remember that as Ontarians, we are in this together, and remember that lives are at stake. So I want to urge everyone to please continue to stay at home, please continue to maintain physical distancing, and please resist the temptation to break from that advice so that we can keep each other safe and all come out of this together. Thank you.
We'll go to the phone line for questions. First question.
From Robert Benzie, Toronto Star.
Thank you, Premier. I just wanted to ask you, when you talk about a framework and a very slow and methodical way of opening up the economy, are you thinking about expanding what is considered non-essential now and will be considered essential? You know, then you have expand businesses and then wait 2 weeks or 3 weeks or whatever, and then do another phase. Is that what you're talking about?
Well, we put a framework together and we're building on it as we talk, but nothing's going to move forward without the advice of our Chief Medical Officer, with the advice of our COVID health team, making sure that we're consulting with jurisdictions, all 444 municipalities across this province, as well as industry leaders within their industry. So I just want to make sure we're so cautious, and we aren't there yet, by no means, but we want to make sure that we give people hope because there is hope. And we do have a strong framework that we will be putting out there. But until then, we just have to continue, Robert, doing what we've been doing. Thanks to the people of this province, this has been paying off in the public domain. So we'll have more to say about it over the next few days.
Premier, the other thing I wanted to ask you about, I mean, you're seeing a lot of people outside of Toronto wondering why they're affected by the province-wide directives. In some parts of the province, there haven't been that many cases of COVID-19. So people are wondering why should they have to abide by the same closures that Toronto is? Do you think that you'll see a situation where down the road maybe Toronto stays under more of a lockdown and other parts of the province open up because they haven't had those cases? Or are you just worried about those COVID-19 spreading into areas where it's not yet hit as hard?
Well, Robert, I've heard the same stories from our MPPs in rural areas, wondering why they can't open. All it takes is one person, just one person, to go visit them that has COVID, and then it just starts spreading again. And then you have to look at the supply chain as well. Supply chain right across the province. If someone's making parts in Parry Sound and it's part of the supply chain in Toronto or the GTA, we have to take that into consideration. As I said, Robert, it was very, very difficult to close down the economy. It's twice as difficult to open it back up safely. And our number one priority is the safety of the people of this province. And I know people get anxious and rambunctious, but over waiting a few more weeks? I'd rather wait and be safe rather than just opening it up. So that's our number one priority, is the health side of things.
Next question.
From Colin DeMello at CTV News.
Hi, Colin.
Hi, Premier. There seems to be a bit of discrepancy in the data that was presented today with the modeling experts and what we see every day released through your government. The data shows, as an example, that there are 127 homes in this province, long-term care homes, that have an outbreak, whereas the data that your government releases every day shows that there are only 114 homes with an outbreak. Similarly, data as of April 19 from the province shows 249 deaths in long-term care homes, yet the modeling data shows that there have been 367 deaths. I mean, that's a huge discrepancy. Can you give us a sense of how acceptable this is to you, that there seems to be two data sets here, and the modeling data experts are working with one set, but we're seeing a completely different picture?
What I'll do is I'll pass this over to Dr. Williams. Thank you.
Yes, well, thank you for the question. And explained in some of the media events I've had before is that when you're collecting data, you collect it for certain purposes and you use it for those actions. The IFAS data, that's the Integrated Public Health Information System, is an epidemiological database. The long-term care ones are administration data, and they're used in a different way. They will be reconciled and they work out in the future as they have the material in there. What's important is that when you get this data in, it's not just that you have a death or a case, is where is that? Where are they linked to? What are the other contacts they have? And what's the context? So that means it takes more time to do that effectively for epidemiological purposes. For administration data, the home or the place that's reporting can tell you administratively what happened that day. The task is for us as the province is to make sure we reconcile those databases. There's always a little bit out of sync in that one, but when they come together, we get a more broader picture, and that's what the modelers like to see, both sides and the whole picture all together, to give a better sense of how they can do their projections.
Okay, thank you. And just a question to the Premier again. So public health officials say that, the earlier projections that you guys are releasing April 3rd really, shook us out of, any kind of complacency and forced people to consider the consequences and took action. And that's why we are in the position that we're in today. How concerned are you that people will look at these numbers and say, oh, it wasn't that bad. Maybe I can start going out again to parks and to public places because the situation didn't end up being as bad as was earlier projected.
Mhm. Well, Colin, I'm always concerned, but I have the faith in the people of Ontario. They're the reason we're in the spot we're in, and we see a little bit of light at the end of the tunnel because they listened to the protocol from the chief medical officer. Vast majority cooperated. You know, you always have the odd person, but the vast majority of the people cooperated, and we have to continue with the message. Please continue, self-isolating when possible, and social distancing. Because of the great work that people have done, we're seeing a little bit of positive results, but there's absolutely no way is this fight over. We're in the middle of this battle, and I just encourage people, don't sit back on your laurels and take this for granted. We're far from over. This battle is going to continue, but if we continue doing what the chief medical officer is recommending in the protocol, then we'll be much better than we were in the past.
Next question.
From Sean Jeffers at the Canadian Press. Please go ahead.
Good afternoon, Premier Ford.
Hi, Sean.
Wanted to ask you about the modeling numbers, specifically as it pertains to the spread of COVID-19 in long-term care. When the first modeling numbers came out, the province took additional steps to close non-essential businesses the same day. Wondering why the province hasn't announced any new measures today to fight the spread of COVID-19 in long-term care homes.
Well, we're putting every single resource we have, Sean, towards long-term care, taking the experts and the hospital staff from the hospitals and moving them over to long-term care. I talked to one of the doctors today. He actually volunteered. We have a lot of doctors and nurses volunteering at long-term care. And the story he told me, since they showed up to this one long-term care, the health workers are showing back up to work because they're feeling a little more confident. We're making sure that these long-term care homes have the PPE that they require, but it's all hands on deck. We're throwing every resource we possibly can at the long-term care homes.
And Premier, by way of follow on your earlier comments about this gradual phased reopening of the province, I'm wondering if there are elements of the province, the economy right now that you think are priorities to reopen that you would specifically name today.
Well, we're putting together that, and we're setting benchmarks and targets that we have to hit. But I think it'd be a little premature right now to throw out industries or areas that we feel would go first. That will come. We're doing our own review, along with municipalities, along with sectors throughout this province, making sure we consolidate with them and collaborate with them. So we're still a few days away to roll this out, but nothing's going to change until we see the curve to continue to flatten or hopefully go down until we see a change. The number one priority is the health and well-being of this province, and I'm not going to budge until that we see that. Over a few weeks of people getting antsy, I apologize to those people, but we'll be better off in the long run.
Next question.
From Matthew Bingley at Global News.
Hi, Premier. Toronto officials are calling for the province to develop a regional strategy to better coordinate shelter systems in the GTA. This comes after a couple of cases, one regional hospital telling them to come pick up a homeless patient who was COVID positive because the hospital said the symptoms weren't strong enough to take up a bed, and they were threatening to place the person out onto the street. And in another case, a hospital putting a homeless man into a cab at 1 a.m. bound for a Toronto shelter. I'm just wondering what your thoughts are when you hear about these cases, and if you would consider helming a regional plan.
Well, I'm always concerned anywhere with congregate living when people are living under the same roof. That's roof, I should say. That's very concerning. We're working with our team. We also are looking into hotels that are available. There's actually a hotel down the street that has offered this to us. If you don't mind, I'm going to pass this over to our Minister of Health, and she can follow up. Thank you.
Well, as the Premier indicated, we are worried about people living in congregate settings, and we've been focusing on long-term care homes, but there's also retirement homes. There are homeless shelters. We are working to develop responses for each group, whether it's a regional group or more specific with respect to each shelter. But we know that these are situations that we have to deal with. The situations you're describing are certainly not typical of the way that we are dealing with those types of situations in Ontario, because we first of all want to make sure that anybody who has COVID-19 is going to be appropriately treated and that they receive the appropriate shelter as well. So in some areas there are hotels being rented, in other places it's community centers in other areas, but every person with COVID-19 deserves to be treated and deserves to have a place to stay.
Just to follow up, the Toronto shelter system is also getting a surge from individuals who are released from provincial programs, like women's violence programs who can't take on the space because of physical distancing, and also people let out of provincial jails are because the province hasn't found a spot for them, they're ultimately ending up in the shelter system. So the city says it needs help. So when exactly could the province really step in to do that, and when could the city see this help?
Well, we've already indicated that we want to help in those situations. We want to help women that are fleeing domestic violence, or men for that matter, that to people who need shelter, that there are other situations beyond homeless shelters where people may be without a home for a period of time. So we want to make sure that they have an appropriate place to be housed, because also as people are staying at home and doing the self-isolation as we're asking people to do, we know that there are situations that may arise of domestic violence and that one partner may need to leave. It may or may not be children. So we want to make sure that everybody gets the protection that they need and that they have an appropriate place to stay. So that is something that we have taken into consideration already in Ontario.
Next question.
From Antonella Artuso, Toronto Sun. Please go ahead.
Thank you. Hello, everyone. COVID-19 seems to be taking two paths in Ontario, the general public and the long-term care sector. Have the public health officials told you that you could actually lighten up some of the social distancing measures on the general public side, or would that have a negative effect on the long-term care, which is struggling to keep their cases down?
Well, they've never said that to myself or anyone on our team. I think we have to continue practicing social distancing. And you see this modeling right around the world, and I'm going to pass this over to our Minister of Long-Term Care, but you see the same modeling where you see in the public domain in some areas, it's getting a little better, but long-term care, it's a very, very tough battle with long-term care, not only here in Ontario, but around North America and the world. But if you don't mind, Antonella, I'll pass this over to the Minister of Long-Term Care. Thank you.
Thank you. So when we look at long-term care, you recognize that the community spread has an impact on long-term care. And you've heard us talk about the iron fence and how we're reinforcing that and taking every measure possible. If you look at the spread within the homes, there are many factors related to that. The vulnerable populations that are there with multiple, what we call comorbidities or disease processes at the same time. And worldwide, and I mention this for context because it's critical for everyone, who's interested in the spread of this to understand globally that over 80-year-old age group is extremely vulnerable to this virus. COVID-19 is a new virus affecting our global elderly populations in devastating ways. Across Canada, similarly. So our community spread, our ability to contain the spread in the community of COVID-19 is critical to reducing the risk to our long-term care homes.
Follow up?
Yes, thank you very much. For the Premier, a public health official said today that she would rather not ramp down social distancing measures only to ramp them back up again. With a lot of experts predicting a second wave of the virus in the fall. I'm wondering what your inclination is. Is it to open up some and then close them again, or is your inclination to just keep everything shut tight as a drum until the second wave has, if it materializes and if it passes?
Well, Antonella, what we really want to do is focus on the advice, again, from our chief medical officer, and also with the communities, municipalities, all 444 of them around the province, and get their input as well. Eventually, we have to turn the economy on very, very slowly, methodically, and make sure that we consult with as many people as possible. But we can't just open up the floodgates and open the whole system up just a little bit at a time. And we're also learning off other jurisdictions around the world what is working, what is not working. And we have to learn from these other jurisdictions, no matter if it's throughout Europe or over in South Korea or down in the US. So we're taking the best modeling they have and adopting it into Ontario, but nothing's guaranteed at all. But when we do turn on the economy, it's going to be a trickle, a little bit of it at a time. See where we are in 2 weeks, a little bit more and a little bit more. We can't rush into this.
Next question.
From Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hi, Premier. I think what everybody wants to know so desperately at home is what is your sense of slowly lifting the restrictions? Are we talking 2 weeks, 4 weeks, 6 weeks? What are you sensing from what the experts are telling you?
Cynthia, I want, and I am giving people hope, because that's what people want. They want hope. They want certainty in their lives. And I just want people just over the next couple weeks, hang in there, continue social distancing, continue practicing the protocols from the chief medical officer. We'll get there. And I know some people are getting, as I said before, cabin fever, and they're getting a little antsy. But we can't jump ahead of this over a few weeks, and we'll open it up. So, but let's just see where we're at. I think the automotive industry in North America, they're opening up roughly around May the 4th, I hear. So let's just see each sector, how it goes. I just do not want to put a date on this. I really don't, because this could bite us in the backside in about 10 seconds. It could come up with a second wave again. I'm very, very concerned about fall, the flu season in fall, and we just have to keep an eye on everything. There's no one out there that wants to open up the economy more than I do, but we just have to hold off for a bit.
Okay, thank you. And my second question is, earlier today, one of the doctors at the news conference on the modeling confirmed that low-income families or low-income neighborhoods are at the greatest risk of COVID-19. What are you doing for those neighborhoods then? What supports is this government offering them? And why still have we not been collecting race-based data that might help us pinpoint them even further?
Well, first of all, I don't believe per se the race-based data, but I do believe in postal code data. And you look at regions and you can look at the communities, and some communities are lighting up like a Christmas tree. And what that allows us to do is reallocate the resources, reallocate people to make sure that they're informed and they get the information that is needed. Some communities, there's a couple families, multiple families living in one home. Not their fault. That's what they can do to afford. But we are monitoring it based on postal code, and then we're putting the resources that are needed in that area. But we do have to measure it.
Next question.
From Mark Douglas at 680 News. Please go ahead.
Thank you. To Dr. Williams first. Was there at any time during this pandemic crisis, was there any time in which you made a recommendation for a protective measure for long-term care homes when you felt that perhaps that recommendation was not being acted on as quickly as you might like to see?
So all the time throughout the pandemic, as we're dealing with the issues at hand, part of our challenge with our data collection is to make sure we go after the most vulnerable first of all. And one of our challenges right from the beginning was to ensure that we had enough personal protective equipment for all our healthcare workers in that regard. So there's one whole group worked stringently at that and are continuing to work at that, as well as the testing and capacity in that area there. We have to identify where our most vulnerable areas are to deal with that so we can get the maximum effect, as you saw today in the modeling, of bending the curve and bringing that down for the overall population. And as we go forward with other ones, including what you heard from the modelers today with the long-term care picture, as the Premier said, we're putting full force energy into that area now to work at that one to try and bend that curve as quickly as we can and as surely as we can as we move forward. So all the steps are recommended are going forward. And would we like to solve everything? Yes, tomorrow? I would, but that's part of the challenge of dealing with a new virus, a new impact on the public and the society, and with our systems that we're ramping up continually to keep trying to bring that curve down under control. And I think as you heard from the modelers, we're moving from a worst to a middle to a best case scenario. So that's to the credit of everybody, including the citizens of Ontario.
Follow up then to the Premier, and this is somewhat following up on other questions that have been asked already, but given the population size and the density of Toronto and how it's so often described as the economic engine of the province, does Toronto require prioritization when the economy reopens?
Well, I wouldn't say any region per se is a priority. We have to look at the modeling. And before I answer that, I want to go back to your first question that you asked Dr. Williams. The answer is never. Never has Dr. Williams ever said, I want this done, and we ignore it. When Dr. Williams speaks and the command table, we act immediately. And there's never been once that we've ever said, no, we aren't doing this or we aren't doing that. If anything, I'm not a medical professional, and sometimes I push the table a little harder than maybe what I should be doing. But I will always respect the advice of Dr. Williams and the rest of the medical team, health professionals at the command table, and I'll never waver from that. But to go back to your question right now about making Toronto a priority, the engine of Canada and Ontario is not just Toronto, it's Toronto and GTA and the rest of the province. We if you add up the numbers, again, we're probably less than 40%ish, roughly, of the overall population. So we always have to make sure we never ever ignore the 60% of the rest of the province and get their input. But I understand your question, but no, the supply chain, everyone's connected. So we have to make sure that we support everyone in the province equally.
Next question.
From Chanel Call at CP24.
Hi, Premier. Thanks for taking my question. I'm just wondering whether you're considering calling in the Army to help out in long-term care homes. This is something that we've heard from Markham's mayor. He's been calling for this. We've also heard from some workers who, they're asking for boots on the ground. They say they're able to not go into work because they're sick or they're afraid. So, Premier, will you be calling in the Army to help out there?
As of today, no. Have we had discussions about it? Absolutely. Do we have a plan? Yes, we do. And, I wouldn't take that off the table. I could be saying no today, and tomorrow we could be calling in the Army. I had a great conversation with General Vance as well a few weeks ago. I just want to thank our men and women that serve our country and the reservists as well, just willing and ready to come in there and support Ontario and the rest of the country any way they can. They're absolute champions, and they're ready. And when the need comes, be it tomorrow or the next day or whenever, we won't hesitate to ask our men and women from our military to come in and support us.
Thanks. And a question for Minister Elliott, just about testing. We're hearing over and over again stories of folks who are waiting, sometimes more than 10 days for results. Can you give us an update on how testing is going? What's the holdup for people that are waiting a long time to get their results, and perhaps why the process hasn't been accelerated?
Well, there was a situation a week or so ago when we did have a backlog of cases. We had about 10,000 cases that people were still waiting for results, but we've dealt with that. And we have significantly increased the number of tests we're able to do. We went from 4,000 to 8,000 in a matter of a week. We're now doing around 9,000, moving up to 14,000 within the next week or so. So people should not need to be waiting 9 or 10 days anymore. They should be receiving their results within 24 to 48 hours. So I suspect that might be a historical issue because we are up to date in our testing and increasing the number of tests that we're doing every day.
Next question is from Laura Stone at Globe and Mail.
Hi there. My first question is for Premier Ford. It's obvious now that some long-term care homes were woefully unprepared for the COVID-19 pandemic, from the lack of PPE to poor isolation policies. So do you take responsibility for what's happened in nursing homes? And should your government have better prepared them for these outbreaks?
Well, Laura, to answer your question straight up, I take the responsibility from the beginning to end of this pandemic. With the long-term care, I'll pass this over to one of my ministers here in a minute, but we didn't expect, and through the advice of our health team, we didn't expect to be able to do what we're doing now, transfer people from acute care, healthcare workers over to the long-term care. We were being ready at the local hospitals throughout this province and having our resources ready for an increase of acute care patients and ICU patients. So once we realized that, we didn't see the overflow at the hospitals, then we had to make a move. And I've always said, Laura, you pull one trigger and make one decision in this pandemic, and it affects 10 other areas. So what I'll do is I'll pass this over to the Minister of Health or Minister of Long-Term Care, either one.
So there's tremendous amounts of preparedness that goes into looking at long-term care homes and how they would function in the middle of this pandemic. I don't think anyone around the world could have predicted COVID-19 coming out exactly the way it did, with its level of attack on our most vulnerable people, the way it was transmitted. This science and this evidence is building, and we've got great minds who are working on developing processes and adapting our protocols. This is a war against COVID-19. There is no doubt. And looking at the preparedness, we've got amazing public service that has been working round the clock, 7 days a week, continually, to make sure that everything that we can do is being done. We've got the Chief Medical Officer of Health and Public Health working round the clock to make sure that we can adapt and evolve as we gain information and realistic challenges dealing with COVID-19. And I say it again, this is a virus that is spread around the world, affecting our over 80-year-old age group preferentially in a vicious way. And every country is grappling with this. And that's an important context. Everything is being done that can be done. We are looking at more tools, the traditional tools that have worked against influenza and the protocols in the homes. Those were there. Obviously, we need to adapt to COVID-19. And that's what we're doing. And I want to thank the public service and public health and our nurses and doctors and personal support workers, everyone on the front line, our paramedics, for coming out every day to look after our most vulnerable people. And our government has been working on this since day one. We've been on this, and it is not a lack of preparation from my perspective and our government's perspective.
Follow up.
Minister Fullerton, to follow up with you then, there are some concerns still that your emergency order does not apply to temporary or contract workers. I know you've spoken about the necessity of this, but seeing as we are seeing the medical community jump in, are you going to reconsider allowing temporary workers into long-term care facilities, into multiple long-term care facilities where this disease could spread?
Well, we've been extremely concerned about staffing. I was made minister in the summer for our new Ministry of Long-Term Care, a dedicated ministry. Our government is the first government in the history of Ontario to recognize the importance of supporting our most vulnerable people in long-term care. And we've been actively working on staffing issues since we started. And this pandemic has accentuated that. And that's why we're using every tool possible. The workers through the agency, the staff through the agencies is important right now to shore up the staff that may be having to self-isolate, maybe having to choose to work in one location only. And this is an important tool that we have. It is a small percentage of overall workers. We take every decision and weigh all the multiple risks. These decisions are all made knowing that they're not going to be perfect and that perhaps something else will happen that we'll have to address. But it is done thoughtfully, cautiously, carefully, and knowing our most vulnerable in our long-term care homes need our support.
Last question.
From Mike Crawley at CBC News.
Hi, Premier. Thanks for taking my question. In the briefing, Premier, Dr. Yaffe talked about how once measures get lifted, it's going to be very hard to go back and impose them again. But we've heard from other public health experts internationally that a likely scenario for the longer term of this is that there could be repeated waves of restrictions get lifted and then they have to get imposed again as infections return. So when you look to the longer term for Ontario, what do you expect the situation will kind of be like? What should people prepare themselves for? Such a thing as that when the restrictions get lifted, that they'll be lifted permanently, or do we need to expect that they could be imposed again at some point in time?
Well, Mike, we always have to be prepared if we have to impose them again. But obviously, that's not what we want to do. We want to make sure at the beginning we do this thoughtfully and carefully and do it in stages, maybe 2-week stages, and look how the results are, and then do another group in 2 weeks. But I'm so cautious. I'd rather be cautious and careful than just open up the economy and have to close it down in September again. So we do want to give people hope. We do want to give them certainty, but I want to make sure safety of the population of Ontario is the #1 priority.
And my follow-up would be for Dr. Williams. It's a bit technical. There was a reference, again from Dr. Yaffe, that in the past few days there's been testing of every resident at 21 long-term care homes, whether they're symptomatic or not. Can you tell us anything about what you found so far from those tests? And are you going to be able to make the detail of those results available to the public?
Yes, well, we're still in the midst of gathering all information from these various nearly 21 institutions. The data so far, most of the tests have been negative. There have been 3 symptomatic individuals that were positive, and there's others we're trying to determine if they're symptomatic or not. That's very preliminary. We got a lot more numbers to come in, a lot more tests being processed. So yes, I would like, and our decision makers and our command table really want to have that data made available so they can ascertain what is the frequency and issue in this in various types of long-term care facilities that would better guide our policy and decision making. And I know the minister and the premier are looking for those results as well. And in the right time, we can release that if and we're pass it through the various command tables.
Thank you.
Thank you, everyone. Thank you.